when you look at the top 10 causes of death in the United States every year, 7 of the 10 of them are related to poor metabolic health. And oh, by the way, this past year, it was 8 out of 11 because we added COVID, which is clearly related to poor metabolic health.
Right. Which, if people haven't figured that out by now, I'm sorry, I don't know what to tell you. It's so obvious. Like, what was it? Something like 80-something% of the people that end up dying had at least 2 or 3 comorbidities. So take for that what you want, people. Yeah, I have one of those, by the way, the waist circumference, and I'm working on that. I'm in the midst of doing a lot of biohacking to try to move that needle, but all the rest of those markers well Within the comfortable range of healthy. And so I'm working on it. I'm not letting that be my bugaboo. Plus, I'm fighting a lot of genetic factors. I had heart disease in my family. My dad had a heart attack at 48 and another one at 50, and then quintuple heart bypass on your operating table at 54. My brother Kevin had 3 heart attacks at 32 and then ended up dying at the age of 41 from the heart disease. I had grandfathers, both died of heart disease. I'm about to turn 50. I'm supposed to get heart disease according to genetics. And I've got epigenetics on my side.
I tell people, genetics plays a role, but it's not a life sentence. And, in the end, genetics is probably only about 5 to 10% of this. Diet is the big thing. What we eat is the main determinant of our health. And we need to recognize that. We need to talk about it. And then we need to give the actual good advice about what to eat, not the garbage that the American Heart Association is pushing out there.
Keto can be hard. Tabulating, measuring, baking, taking 3 months to perfect one recipe, and to mixed reviews.
Did something die in here? Oh, I think it moved.
And by that point, you give up your diet, find a dark corner, and stuff yourself with sugar, carbs, and regret.
This, isn't what it looks like.
Well, this is where Keto Chow saves the day. The easiest, tastiest, ketoist meal replacement on the market.
It's like ice cream melted in my mouth.
Yes, but melted ice cream with all the protein, nutrients, vitamins, and electrolytes your body needs.
Oh, that's cool.
And with 3 starter kits, each with restaurant tips, keto food guides, and a ton of flavors to try. Your taste buds and your waistline will thank you.
Thank you.
So grab your starter kit today at jimmylovesketochow.com.
It's so easy.
Keto Chow. Make keto easy.
Well, that's where we get into trouble. Doctors say, well, go eat better. And then people read materials from like the American Heart Association. Oh, well, they say cut your fat and your red meat. And so I'm eating better. And then that doesn't help them. And they actually go on a statin medication, they're eating their low-fat diet, and they get frustrated. And then they have a heart attack.
That is the common question that I get. And that's why I wrote this book. All of the patients who end up on my operating table, that's what they say. Why did this happen? And, a lot of them, it's obvious, they're smoking and they're eating, processed food and fried food and all that all the time. But many of them are. And so we need to start questioning that advice.
And on top of the nutrition, which I think is paramount, you definitely understand that very well. I think people live too stressed in their life as well, which is why I've implemented a lot of relaxation techniques. I do a lot of deep breathing, kind of meditation. I got a hot tub that I chill out in. I do a lot of like mindful chilling out because I know that sympathetic state.
Yeah, in my book, I actually outlined 7 principles of metabolic health, and eating whole real food is one of them, but I talk about reducing your stress, getting adequate sleep, moving more. These are the other, pillars that are going to contribute to your metabolic health.
So, Gina, I have a question about statins, why they're used so much and why they're harmful. And we could go on and on about that. I wrote a whole book about cholesterol as well, called Cholesterol Clarity, and did a whole just on that. And it seems to me now that they're no longer a name brand and they're kind of off brand and they're pretty cheap to get a statin. Now they're saying, well, you need a statin plus. And so talk about some of the new medications that they're trying to promote to lower cholesterol, which would ostensibly lower your heart disease risk, is what they think.
Yeah,
Why
so
maybe they don't do what they say they do.
Now, where statins have been the most widely prescribed class of medications for the past 20 plus years, and it has not had a noticeable effect on the incidence of heart disease. So, a logical person would look at that and say, maybe statins aren't the answer. Maybe lowering cholesterol isn't the answer or the only answer. But instead, organizations like the American Heart Association double down and say, well, we must need to get patients' cholesterol levels even lower. And so there are new medications out. The PCSK9 inhibitors are kind of the big thing there, but there are some additional ones. And, they are now recommending that people, get their cholesterol as low as possible. Like, 0 is literally the goal for some of this, and it's insanity. Cholesterol is in our body for a reason. We have plenty of good data that's showing having a low cholesterol level is a risk to your health. The mortality, when you look at the overall mortality, exactly, your brain is made of cholesterol. Cholesterol plays a part in fighting off infectious diseases in your immune system. Cholesterol is the precursor to all of our sex hormones, testosterone in men, estrogen, progesterone in women. Cholesterol plays a very important part in our bodies. And to just say that we should try and eliminate it essentially from our bodies is crazy.
Well, and it's crazy because there's so many like hormonal pathways and vitamin D synthesis. Like, there's so many good things. I remember Sally Fallon Morell was on my podcast many years ago from the Weston A. Price Foundation. That I want my cholesterol as high as possible. And I was like, yeah, like it's sacrilege to say that in our day and age because it's been so vilified. Cholesterol in the body's been so vilified, but it's true. And even like in my research for Cholesterol Clarity, they looked at a lot of the traditional tribes to see what like their normal cholesterol was as they got older. And the older you got, the more cholesterol you wanted because it's anti-inflammatory cholesterol is, and it just has so many good properties, and it's the boogeyman in your health.
Yeah, exactly. Again, this all started with the flawed concept. We looked at a group of people who had very high cholesterol levels, familial hypercholesterolemia. It's a, genetic issue. And some of those people had heart disease. Important to point out that not all of those people get heart disease. But even, within those people with exceedingly high cholesterol levels, there seemed to be an increased incidence in heart disease. It got blamed on the cholesterol. And then it just became a self-feeding sort of narrative that we need to lower everyone's cholesterol as much as possible. And the science simply doesn't support it. And, you look at the benefits that we get out of lowering cholesterol, and they're nowhere near as much as, the drug companies would lead you to believe.
Well, look what they did. They manipulated what normal cholesterol is. So that 200 number that's kind of been the gold standard, they keep trying to push it down to 170. But the 200 number that they settled on, it's the only number that I'm aware of, maybe you can correct me if I'm wrong, but of all the different numbers on all the different parameters, usually they try to go kind of 80th, 70th, 80th percentile of, okay, if you're above this line of 70th, 80th percentile, more likely to be at a disease risk. And if you're below the line, you're less likely. Well, guess what it is? That 200 represents the 50th percentile. So they're saying half the population is diseased and half isn't.
Yeah, it really is.
That's ridiculous.
I see it every day. About half of my patients that end up on my operating table for heart surgery have low or normal cholesterol levels. Sometimes because they're on medications, sometimes without medications, but they're still ending up on my table. And so, again, we need to take a step back and say cholesterol can't be the answer. there's got to be something else going on, and that something else is clearly metabolic health.
Yes, which then translates into higher inflammation markers. So that's one thing that could be looked at.
Yep.
Also CAC scores, the heart scan, and get the heart calcium score. Nobody's on your operating table that doesn't have a very high CAC.
Again, when we look at the data, the recent study came out of the Women's Health Initiative where they looked at, the risk associated with only having a high LDL cholesterol level in terms of heart disease. And it was about a 1.2x risk factor, a small risk factor. When you look at insulin resistance is what they measured in that study, but metabolic health, it is a 6x risk factor. So, why are we so focused on the cholesterol part of it and no one talks about the metabolic health part of it?
How did they measure the insulin resistance? What were the markers?
The LPIR score, which is one of the laboratory measures.
Yes. So there's a test from this company called Liposcience, you guys, called NMR lipoprofile test. And one of the markers on there that I love that they do that is this LPIR score. And it's an insulin resistance score. It's on this spectrum. And if you're on the lower end of the spectrum, it's less insulin resistance, more insulin sensitivity, and the higher, worse. And they're all on the high end is what you're saying.
Advanced testing, simply looking at your triglyceride to HDL ratio. Again, it's on your basic cholesterol panel. It's part of your metabolic health measurement. And if that ratio, the triglycerides divided by your HDL, is less than 2.
So looks like Donnell has a question about statins and whether you have a high CAC score, if the statin will help. That's not what the statin does, is it?
Statins have not been shown to reverse, undo CAC scores, lower CAC scores. In fact, the data goes the other way. It shows that statins oftentimes raise CAC scores. And, there's some debate about, whether that's beneficial or not. I would say probably not. But, I think we have clear data about the flip side of that question. If your CAC score is 0, there is clearly no benefit to statin therapy.
Right.
So no
matter what your total cholesterol is.
Correct.
Yeah.
Correct. And that's been very well shown in the literature. If you do have an elevated CAC score and an elevated cholesterol, there is a discussion to be had about whether or not statins may benefit you. But that is a very nuanced discussion.
Yes.
You need to be working with a practitioner that understands this very well. It cannot simply be a checkbox that, your LDL cholesterol is high, you should be on the statin. There are many factors that go into it, things like inflammation, insulin resistance, your types of cholesterol particles that you have. All of this needs to be factored in.
I remember interviewing a general practitioner who's into kind of ancestral diets, keto diets. And I said, is there anybody that you recommend in your patient population that they go on a statin? He said, if they refuse to do the diet, I feel like I have no other choice but to throw that at them to try to at least acquiesce some of the impact of their metabolic health from their crappy diet. And I'm like, wow, that's depressing.
Yeah, and I would agree with that. And yes, there are some patients who benefit from statins.
Yes.
It's just nowhere near as many. When you look at the data on statins, for instance, everyone who gets put on a statin for LDL cholesterol above 140 without a history of heart disease, we know that what we call the number needed to treat is about 1 in 300.
Yes.
So that means 1 out of the 300 people every 300 people that get put on that statin, one of them will benefit.
Right.
So, we need to do a better job of figuring out who that one person is.
Right.
And stop, wasting the resources on those other people.
Well, wasting resources and the unintended consequences to those 299, because a lot of them get the muscle aches and pains, and a lot of them have increased risks of things like diabetes and cancer, and even heart disease risk for a lot of people taking a statin. Like, that shocks people when they find out there's like a 12% increase risk of heart disease taking the thing that's supposed to prevent a heart attack, at least in the minds of the public.
Yeah, I think in the end, I don't say that statins have no use, but they're very overused and they're not used in the proper situations. And we need to do a better job